Good evening, everyone. My name is Mayra Patlan, and today I will be speaking about our oral hygiene. I am pretty sure everyone in this room brushes, but do you floss? Yes, brushing does get rid of the bacteria, but it doesn't get rid of the bacteria that's in between your teeth. This accumulated bacteria later on causes cavities, periodontal disease, and bad breath. Remember, flossing keeps the plaque away. Cavities are tooth decay. This decay starts forming due to the accumulated bacteria in between the teeth. This then causes change of color, pain when you eat, and usually when pain usually gets this bad, the only solution is either a root canal or a cleaning. A root canal or an extraction, It usually causes a root canal and extraction. Depending on the dentist you go to, this could be very, very costly. So if you could see right here, this is like severe cavities. I'm pretty sure this patient is in a lot of pain. So these teeth might have to go depending on what the doctor diagnoses. According to the CDC, periodontal disease is common in Americans age 30 or older. This equals about 64.7 million Americans. Periodontal disease is the inflammation of the gums that affects the soft and hard structures that support the teeth. In the early stage of periodontal disease, the gums become very red and puffy. They become very red and puffy like this. They also start to bleed exactly like this. So this is the early stage of this is still not periodontal disease, this is gingivitis, and then after this it will turn into periodontal disease, which periodontal disease then looks a little like this. So this is already severe periodontal disease right here. As you could see, this patient has tartar accumulated all on top. Once that is removed by a process called scaling and root planing, the tartar comes off, so the tooth starts to become loose, and it looks exactly like this because the tartar is what was holding the tooth together. So if you were with this patient at this moment and you touch this patient's tooth, their teeth will be wiggly. So once that happens, obviously the tooth will fall out on its own, or you have to go back to the doctor and have that teeth removed. This usually, once you get a tooth removed, I'm pretty sure you don't want to be walking around without teeth. So then this becomes a bigger headache, and you have to pay for either dentures or implants. And even implants, it depends if you're even a good candidate for them, because if you lost so much bone, implants are usually not for you, so you have to stick to dentures. Also, bad breath can be avoided by flossing regularly. The reason you might have bad breath is because all of the bacteria in between your teeth and tongue The reason you might have bad breath is because of all the bacteria in between your teeth and tongue are not being scraped away. So when you brush, you need to make sure you brush your tongue. That is one of the main reasons you also have bad breath. So if you don't brush your tongue, I'm pretty sure your tongue looks like this. So once it starts looking like this, the way you can get rid of it is by either buying a tongue scraper. If you want to get a little bit fancy, a tongue scraper looks exactly like this, or you could just simply use your brush and it could get rid of it. So when you brush, you gotta make sure you brush for 2 minutes, and when you floss, you gotta make sure that you go in between the teeth and you come in between and you get out of the teeth in order to get all that plaque out, because you don't want to get cavities or periodontal disease or bad breath, just like I said. With dental appliances such as braces, it could be a little bit tricky to clean your teeth, so you need to make sure that you floss with the floss threaders usually help. So having dental appliances is not like that's not an excuse for you not to floss, okay? By spending a little extra time in the morning and at night, flossing and brushing will give you that beautiful smile you always wanted. So today I want you to head to your nearest store and buy you some floss and start flossing to prevent cavities and periodontal disease and bad breath. Thank you for listening, and I hope you put this into action.